950. Real Texas, Real Talk. KPRC Houston, an iHeart radio station.
We have tracked down noted cardiologist. I hope I'm getting the pronunciation close to being right, Dr. Farah. Dr. Fahmi Farah. Is that accurate?
You got it. That's correct.
Yeah. Oh, good. Thank goodness for that. I hate to get off on the wrong foot with a cardiologist, especially as it relates to pronouncing her name.
It's quite all right.
As you know, there's been so much attention to vaccinations and the symptoms of COVID-19, and some people having just severe reactions to it and other people having virtually no reaction to it at all. The one thing that we seem to be finding out that is just now seemingly starting to get some attention is whether or not there are some long-term impacts, in particular to the heart, caused by COVID-19, even if you didn't get a particularly severe case. What have we learned about that so far?
Yes, we over the course of the last 1 year of this pandemic, we have learned that COVID-19 is causing heart problems in many patients, even those who are having mild symptoms, and even those who are asymptomatic with COVID. Many of them are coming up after recovery from COVID infection with heart problems, such as chest pain, shortness of breath, palpitations, rhythm problems. We're seeing a wide array of cardiac problems in COVID patients.
Now, what you're describing, and take it from a guy who's been through all this type of stuff before, it sounds like, and I'm not saying it's not COVID-19, it could very well be, but when I was younger, I had heart palpitations, I had shortness of breath, and it was stress. 100% stress. I know there's a lot of stressed out people right now.
You're correct. Stress definitely is a component. So there are two forms of cardiac patients we're seeing. One, it is truly a cardiac pathological issue related to COVID-19, such as true heart failure or, inflammation of the heart muscle called myocarditis, or arrhythmia, as I mentioned earlier. But you're right, there is a lot of anxiety out there, and we're definitely seeing a lot of patients in the outpatient setting and in the ER with anxiety-related heart problems. So they're having, palpitations, chest pain because they're anxious. So there's a lot of that as well.
Now, one of the scariest things I've seen, and I'm guessing at some point you have probably seen the video on this, Florida basketball player Keontae Johnson, during the middle of a game, is jogging down the court, and he stands straight up and keels straight over on his face. He had some sort of a cardiac event. He's okay, I guess. I don't know what his long-term health implications look like, but just about everybody has seen that. It was from the Florida LSU men's basketball game. He's finally well enough, I guess, to actually attend the game. I almost thought he had died right there in the court. It was that graphic. Have we seen these types of incidents where people have a sudden cardiac event like that?
We are, yes. And in fact, I've done a few interviews a few months earlier, regarding athletes in particular. We have seen quite a few athletes, even, at national level, get affected as a result of COVID. They had, mild symptoms. Some even had asymptomatic, like they really didn't have any symptoms from COVID. But then once they got out into the field and started their rigorous routine of, sports, that's when they realized that they were not able to do what they could before. And that's how it came about, that they were having heart problems as a result of COVID. And then there were those who didn't have that chance. We did have some fatalities in athletes as a result of COVID from heart conditions that was created by COVID. So yeah, we're certainly seeing people who have recovered or are not recovered in the midst of the infection having sudden issues with heart problems such as heart failure or cardiac arrest. Some people are having heart attack. So we're seeing a wide variety of heart conditions.
We've discovered that people who have had COVID-19, at least some people who have had COVID-19, have developed heart conditions as a result. We have also discovered, by the way, that some people have had COVID-19. In fact, I saw a story about how they're noticing, at least one Texas surgeon noticed that some post-COVID-19 lungs have more scar tissue than smokers' lungs. That's, wow. That's saying something. So I think we're gradually going to learn more and more about the long-term health implications for people who have had COVID-19, even if they were asymptomatic. There is a possibility that there could be something longer lasting that you're going to have to deal with. Now, we're not sharing this with you to scare you. Mainstream media's done enough scaring people. We're just trying to inform you so that you can kind of get checked up on and make sure everything's good. Dr. Fahmi Farah is with us. She's a cardiologist based here in Texas. So we know that people have not been very good about keeping doctor's appointments in this COVID world that we've been living in. Is that getting better? Please tell me more people are coming to the doctor.
For a while, you're right, especially when the shutdown happened during the shutdown and shortly after that, we saw a huge decline in the number of patients who are coming in to see us in the clinic and especially in the ER. Like we were so concerned because we saw nationwide as much as like a 25% drop in emergency department visits for heart attack. And heart attack is such a time-sensitive matter that you really can't and shouldn't put it off because it can really kill you. And those who survive the heart attack as a result of delaying, they can sustain serious damage to the heart and long-term consequences from that. So, yes, to sum it up, we did see a decline, and it improved for a while. And now that the surge is happening, we're again seeing another decline in the outpatient setting at least. So my advice would be to please not do that. Your heart health is absolutely important, especially during a pandemic, because you want to have an optimal heart health so that if something should happen, you're ready to battle it.
Hey, maybe you can back me up on this one, Dr. Farah, because I know that there is a link between dental health and heart health, and I know that one of the areas in particular where people have really cut back on during all this is going to the dentist. Not a good idea, especially if you have a heart condition, right?
Yes. Obviously we all have to be safe. Dental work, it is part of your health. You need to take care of it. And yes, there is a connection between dental health and heart health. There's something called endocarditis. It is basically an infection within the heart valves. The most common cause for having this is if there's an infected tooth or that's not being taken care of, or as a result of dental work. So that's why it's important for us to maintain good dental hygiene and receive proper care in a timely manner so that there's not an infected tooth just sitting there ignored, because that infection can get into the bloodstream and eventually travel into the heart and cause endocarditis. So we want to avoid that.
All right. Dr. Farah, for those who've had COVID-19, maybe had a very mild case, maybe they're middle-aged or older, have never had a history of heart trouble before, but they want to be particularly cautious so that they can recognize some of the signs if they're having some issues. You mentioned shortness of breath. That's something we need to be careful of. What are some of the other things that you've noticed as potential symptoms of potential heart problems that people need to be aware of and be seen over?
Yes, there are some classic symptoms that you need to be aware of, such as chest pain, chest tightness, heaviness, indigestion symptoms that are just profound and different from your usual and won't go away with taking, over-the-counter medications like Gas-X and, GERD, like reflux type of medication. Shortness of breath, fatigue is one of them as well. If you're having, decrease in activity tolerance from what you're used to, swelling in your legs, all of those are signs for heart problems. Also palpitations, if you feel like you can feel your heart beating fast or in an irregular pattern, you need to see your doctor.
Okay, that's all good advice. I think we're going to learn more and more as the years go by of some of the potential health implications here. Is it safe to say that not everybody has these types of problems after heart or lung problems afterwards? It's what if you had to put a percentage on it? Do you have a best guess about what percentage of people seem to have post COVID-19 symptoms that they continue to carry with them?
I don't have an exact percentage, but when it comes to heart problems, for those who have completely no symptoms, like asymptomatic patients, and they continue to be asymptomatic beyond recovering from their COVID-19 they don't necessarily need a heart checkup unless they become symptomatic with some of those, like chest pain and shortness of breath that I described. For those who have moderate to severe degree COVID infection, especially those who are requiring hospitalization, a lot of them are having complications, like, heart complications down the road, even after recovery. For those patients, it is worthwhile to seek care and actually get a cardiac evaluation. It's not a bad idea to get a cardiac evaluation and see a cardiologist. And again, even those with mild symptoms to no symptoms, if down the road they experience any of these heart symptoms, they also need to seek care.
Okay, great advice. Appreciate your time. Thank you so much, Doctor. Have a great day, and again, appreciate you taking the time to talk to us.
Thank you very much for having me. And again, I advise everybody to take the vaccine who has it available, as long as you're not allergic to any of those ingredients. Appreciate you.
Okay, thank you, Dr. Fahmi Farah.